Hey, friend, if you're going through perimenopause or into menopause, maybe you're experiencing some vaginal dryness or decreased libido or more frequent urinary tract infections or changes down there that you want to know more about and how to treat, then this podcast is for you. Joining me, I have the honor and privilege of speaking with Dr. Anna Cabeca, who I had the pleasure of hearing from at the A4M meeting. And after listening to her presentation and the way she breaks down information, I knew I had to have her on the podcast. Anna Cabeca is the best-selling author of The Hormone Fix, a book that we talk about extensively in this podcast, and Keto Green 16, and Menopause. Dr. Anna Cabeca is triple board certified and a fellow of gynecology and obstetrics, integrative medicine, and anti-aging and regenerative medicine. She holds special certifications in functional medicine, sexual health, which we get into quite a bit on this podcast, and bioidentical hormone replacement therapy. She lectures frequently on these topics throughout the world to large audiences and is known nationally as the Girlfriend Doctor and is host of the Girlfriend Doctor Show. She has personally developed natural products to help women balance their hormones and thrive through menopause, including the highly acclaimed Julva Cream, which we talk about in this podcast episode, and Mighty Maca Plus, a powerful superfood blend. Join me for this awesome discussion with Dr. Anna Cabeca and how women can take charge of their sexual health and master menopause. Well, Dr. Anna Cabeca, I am so honored to have you on the podcast as a triple certified physician, master of menopause, and I've been learning so much from you through A4M meeting and following you on all the platforms. And I just really want to thank you before we get started. And thank you for coming on the podcast today.
Oh, it's my pleasure. You know, there's a saying that your mess becomes your message.
Yeah.
So I've learned a lot of what I know through my own messes and history. And so, you know, being here with you and to talk about this to your audience is truly an honor. Thank you.
So I thought we would start, I've read your awesome book and I highly recommend it to anybody who's going through perimenopause and into menopause called The Hormone Fix. I'm holding it up right now. If you're watching the video portion of this podcast, I really learned a lot. And I thought we can start with, talking about that perimenopausal time for women, what's going on in their bodies. We can dive into menopause and what happens there. And then where I want to take this conversation after that is really looking at those three key hormones that you talk about and how they go awry. And then we'll go into other things from there, but really focusing on first, what happens to our bodies during perimenopause and into that menopause and that transition time.
Yeah. And it's, again, there's so much complexity to it. And each woman is individual based on what their stress level is, how well they're sleeping, what hormone disruptors, what their genetics are, and their nutrition and lifestyle. All those factors come into play with how we transition. But typically what we see is that in our, for both men and women, actually, in our mid to late 20s, we start to see a decline in one of the precursor hormones to testosterone and estrogen, and that's DHEA. One of our adrenal hormones is produced 50-50 in reproductive ages, 50% ovaries or testes and 50% adrenals. And our adrenals are our stress gland responders. As our reproductive hormones start to wane, ovarian function starts to decline, we rely on our adrenal glands to make more of that hormone. And from DHEA, we make testosterone and estrogen. So with a decline in DHEA, we start to see a very slight dip in testosterone and estrogen. But in our mid-30s to mid-40s, late 40s, we start to see a really rapid decline in progesterone. So by, from age 35 to 55, it's estimated that we're producing 75% less progesterone. And that's significant because progesterone's our mother hormone. Think of the hormone cascade. We make our hormones, our mother hormones, progesterone and pregnenolone, from cholesterol. And so as our ovaries start to decline in function, we start to make less cyclic progesterone. And again, our adrenal glands have to pick it up. And so midlife tends to be a perfect storm of things happening. Maybe we're raising teenagers or just getting into empty nesting, and maybe work has more challenges while our bodies is facing its own challenges too with these natural hormonal transitions. So working on those things can make a really, make a big difference as our hormones are changing. And then, our estrogen and testosterone will decline and continue to decline, through the rest of our life, but still be produced at some levels well post menopause. So as long as we can maintain healthy ovarian functions associated with longevity.
Yeah. And I think that's really important for people to understand that this is physiologic and what is actually going on in our bodies. So when I noticed a reduction in progesterone, is that I started to notice that I wasn't feeling as happy. I wouldn't say I felt depressed. To me, depression is more clinical. I felt like just a little bit lost myself, a little bit more blue or a little more sad, or just feeling like a little off and maybe not as motivated to go to the gym or take care of myself or eat healthy. And I felt that being put on progesterone really helped that. And then learning, oh, this is natural, right? It's not something that's a disease, right? But something that's natural that's happening to my body. And I really like learning about how that wanes. And just by giving back a little bit of hormones can really help rectify some of those symptoms. What are other symptoms that you feel and you find that are common in your practice for women making this transition besides the anxiety and feeling a little blue?
So along with that is the difficulty sleeping, right? We see that a lot, difficulty sleeping. And, for gynecologists, we see the irregular menstrual cycles, the breakthrough bleeding, the heavier than normal periods, the more painful menstrual cycles. Those things are happening at the same time. So those gynecologic issues are happening at the same time as the neurologic issues, like you said, the moodiness, worsening PMS, anxiety, irritability, feeling more brain fog, less, like I've lost my edge type of feeling. And until recently, really, Sherry, like one of the things that I didn't recognize, I always look at the combination of our hormones and our neurotransmitters, like progesterone supports GABA, which is our hormone. And like, it's like, think of GABA, think of the rock group ABBA, think of like just Mamma Mia musical and think, oh, that feels good, right? It's a feel good hormone. And estrogen relates to serotonin, testosterone relates to dopamine, our drive hormone. And as when you get into this fluctuation of what's really happening, I realized that progesterone also supports tryptophan, which is a precursor to serotonin, which is a precursor to melatonin, so affecting our sleep. And during this time, if we're not making enough progesterone, we don't have enough circulating tryptophan, so less 5-hydroxytryptophan, and estrogen supports serotonin. So if our estrogen's also declining, we're making less serotonin. So we're having more anxiety, mood disturbances, less, bright colors and enjoyment in life. And that's affecting our quality of life. So it's coming at us from both ways, making less serotonin. And then from serotonin, we make melatonin, our sleep hormone. So in this cascade, there's this function of, like I always say, we have a bucket of hormones, and in perimenopause and menopause, we've got to fill back up our bucket, but we also have to plug those holes. So hence this whole rejuvenation perspective, and where I like to say it takes more than hormones to fix our hormones, because we got to plug those holes and keep our buckets full as long as possible. But that whole cascade between progesterone and tryptophan to serotonin, estrogen to serotonin, and then melatonin. If we're just addressing the end stream results, like we're giving you anti-anxiety hormones or anti-anxiety prescriptions like SSRIs, we're giving you sleep meds. I mean, those are two of the most common prescriptions that are prescribed to women over 50. And add in the anti-inflammatories and digestive support supplements or the antacids. And so those are the 4 most common prescriptions. And if we never address the underlying reasons for those hormone imbalances, we're just putting Band-Aids on. And before you know it, people are on multiple medications, treating side effects of medications and never getting to the root cause. So I think that's the perspective that is critically important. And then from melatonin, one of the metabolites we make is oxytocin. So, it's like creating that deep, restful sleep, feeling connected beyond the insulin, cortisol, those other major hormones I talk about. This cascade also decreased sleep, more depression, feelings of isolation, feeling like you want to create a smaller world, doing less of the things you enjoy, also because we're making less oxytocin unless we focus on these major, making more oxytocin. Naturally, our body's an incredible pharmacy, better than any drugstore you can go to. So making our own oxytocin and supporting our body's the drain on our reproductive hormones from stress and cortisol.
Yeah, and I think that's so important for women to hear. Not that prescription medications are bad per se, and we're not saying that, but just throwing out a prescription for anxiety or for sleep, or for an antacid because now you have gut issues and really not addressing the root cause. And some women turn to alcohol, right? Because they're feeling emotionally not themselves. They're not really understanding what's going on with them biologically, and it's coming and being expressed like emotional volatility. And they want to maybe isolate, like you said, because of all these changes. And so getting to that root cause and really treating with something that's going to help all of that and getting to actually what is the root cause, I think is so helpful. So I want to talk
Well,
about why we have been so fearful of hormones. I know I'll bring my bias is that in pharmacy school, we talked about, hormones were dangerous unless you're just using birth control. There's, the side effects that we learned about that came out in the Women's Health Initiative. And of course, that scared everybody. But looking at the reanalysis, I don't think that's gotten enough attention and enough press. And I love how yourself and other clinicians and practitioners and doctors are talking about, the redo of that study. I mean, the reanalysis of it. And we were wrong about some of that. But I think there's just widespread fear about hormones. And can you talk about any of that and how you work with your patients to understand that bioidentical hormones can be a wonderful thing to add to a woman and helping them transition during this time?
yes, absolutely. Because again, there was so much fear. I was early in practice. I trained at Emory University in Atlanta as a gynecologist and obstetrician. So I was, like you said, brainwashed on, the birth control pills and Prempro. And then I started looking at some of the earlier studies, even as I was completing my residency on Prempro, because during my residency, I participated in an arm of the HERS trial, which was the, heart disease and estrogen replacement study. And I was looking at, okay, well, an aspect, I was studying and researching an aspect of that trial in communicating with physicians about hormone replacement and what your physician, what did they tell you about it? So it was really interesting. And so I started seeing, okay, well, we're not seeing great cardiovascular benefits, but like this doesn't make sense because the hormones are designed to be neuroprotective, breast protective, bone protective. And so, maybe it's the type of hormone we're giving, and it's also the route of administration. So those two aspects were, in the forefront of my mind. Now, I was a research scientist before I went into medical school. So I had this, and I did exercise and respiratory physiology research. And so, I had this, I always like to understand the mechanism of action of these drugs and these medications. What's the mechanism of action? So when the Women's Health Initiative trial came out, and in 2002, I remember the day because I'm in practice in Southeast Georgia. And, I just had to pause for a moment and look at the data. I went to the data and I was like, okay, well, what's going on here? Okay, the estrogen only arm looked at did not have an increased risk of breast cancer, but is associated with increased risk of heart disease and stroke. Well, oral estrogens increase inflammatory markers. And so that made sense to me. And then the progestin arm increasing the risk of breast cancer was like, whoa, what's going on here? It's not progesterone. Progesterone should be breast protective because it affects the P53 enzyme, inducing apoptosis, which is natural cell death in typically unhealthy cells. So what's going on? And then so I did an analysis of that and also showed the protective effect on colorectal cancer in the estrogen arm, as well as decreasing osteoporotic fractures. I think we had all that in 2002. And so that was fascinating to me and had to really look at what I was doing. I said, well, why don't we use, at that time we had prescription prometrium. And I was just, in 1999, I started working with compounding pharmacists to help with my breast cancer clients, looking at, the ability to help them with, sexual health issues and desire and vaginal dryness consequences and the consequences that come from post breast cancer treatments in so many clients. So I'd already started working with bioidentical, but we had prescription prometrium, which is a bioidentical progesterone. And in 2005, Dr. Fournier out of France published in the E3N trial the bioidentical progesterone oral form compared with oral forms of progestins, including medroxyprogesterone, which is Provera, as well as for example, norethindrone, pregnane and norpregnane derivatives. In other words, different formulas. And this can be technical for people, but stay with me for a second. So we looked at, okay, well, these are not identical to what your body's making. I think God has more wisdom. Mother Nature has more wisdom than we do in general, and understanding the nuances of the pharmaceutical preparations compared to what our body's making naturally. And so that E3N study showed, okay, well, bioidentical progesterone did not increase breast cancer. And the synthetic progestins, especially Provera, had a 4 times increased risk of breast cancer. And then the norpregnane derivatives, a little bit less. But they all had a significant increased risk of breast cancer compared to progesterone, which did not. So from there, 2005, there was no chance I was prescribing, with rare exception, any synthetic progestins because they don't work well. Plus, my patients would feel so much better when switched to a bioidentical form. And that's better than any study. And when your patients are coming in and say, Dr. Anna, I'm sleeping better, my mood's better, the world's in Technicolor now instead of shades of gray, I'm just feeling so much better, you know that you're onto something, right? Because it's just substituting one for another and they were doing better. And, that convinced me. And from there, formulating combination bioidentical hormones with testosterone and DHEA, using vaginal preparations for bladder health and sexual health and orgasm, it just seemed like, okay, well, this is the safest way to go in optimizing hormone balance. But the world was already scared of it at that point. And so through my own work and research and clinical experience, I started lecturing and writing about what I was finding and seeing.
Yeah. And thank you for explaining the differences between the progestin, which is not bioidentical, the MPA that was used in the Women's Health Initiative, and the reason we saw some of those effects, and why we're proponents of bioidentical, because they are safer and the natural type that our bodies produce. So thank you for separating those two out and discussing some of the history around that and where the fear came from. And so it's understandable that if you haven't been keeping up on the data or learning in addition to what came out beyond the Women's Health Initiative, right, you may not know of these beneficial effects, and not maybe every practitioner does. And finding one that can really help you get the resolution of symptoms that you need, because you deserve it. And I want to talk about something that I feel you're so versed in, that I've learned actually the most from you, is this relationship. I knew cortisol, the belly fat, estrogen could come from belly fat and cause more visceral fat, which is the most dangerous kind. But I wasn't so clear on the role of oxytocin. And I learned from your book and your lectures about, when cortisol is up, oxytocin goes down, and just how prominent the symptoms can be of that and how to reverse that. So can you educate my audience a little about this relationship between cortisol and oxytocin, and then the benefits of oxytocin therapy?
Yeah. And honestly, if it hadn't been to my own personal experience, I wouldn't have realized it myself. It's not something we're trained in or taught, was never anywhere published per se. And, certainly not in women's health at all. In some trauma, PTSD, I learned from Dr. George Crusoes, who studied PTSD in children and their effect of, persistently dysfunctional adrenal dysfunction, as well as lower oxytocin levels. And I started asking questions because one thing for me through my own personal journey and my trauma, and I write about this in my book, The Hormone Fix, I share that part of myself. And I'm, again, with gratitude for all my patients who have shared their stories with me as well. And through our trauma, I had significant PTSD. So post-traumatic stress disorder, combine that with daily, everyday chronic stress, man, you're in I was in a perfect storm. And for my relationship with my husband at the time, we knew we wanted to keep our marriage together. But, eventually it was like, I know I love my husband. I don't feel love for him. And I remember thinking that I just don't feel love for him. I'm completely disconnected from him. I was burning out from my practice that I loved, that I built with my own two hands. Practice. I loved my patients, but I just didn't feel like going in anymore. I was burning out in so many ways in that physiology. So I recognized that when I improved my stress response, when I empowered the practices that increase oxytocin, I felt better. I felt more connected. Now, I didn't learn that till after I was divorced, but this was that thing. Okay, in the back of my mind, why did I feel such disconnect? I mean, it was a tangible disconnect. And so what happens is when cortisol goes up, oxytocin goes down, which makes sense because when we're in that fight flight mode, when we're in stress, when we're, have an enemy that we're facing, there's no time to love and hug and connect and relate, with that enemy. You're not in that place. So oxytocin's low. And when cortisol's up for a long period of time, a protective mechanism in the brain says, okay, you're frying me out. I'm going to shut you down. And so cortisol then gets suppressed. It's not like our adrenals don't fatigue. They get dysfunctional, but fatigue. It's not like they've shriveled up and died off, for instance. We don't lose the cell mass of the adrenal glands per se. But we get this suppression of cortisol because it is that, you're frying me out. But when cortisol is low and oxytocin is low at the same time, it's that physiology of disconnect, that physiology of burnout, that physiology of divorce, the physiology of, I know I love my work or I love my family. I just don't feel love for them. And as I saw that and I made that connection in myself, I started asking my clients and my patients. And I remember a client came in who was a veteran from a foreign war and said to me, I go into my house and, I know I love my family. I just don't feel love for them. Say the same thing, right? Say the same thing. So I started digging into low oxytocin physiologies, like, for example, autism, low oxytocin, unable to make eye contact, can't be touched. You have that lack of intimacy and connection. In PTSD, there's that disconnect, that withdrawal, that loss of emotional intelligence, or not intelligence per se, because the intellect is there, but the emotional capacity. Thank you. And so I started, looking at clients like that, or someone with a very traumatic birth and feeling like I can't connect to my baby. Like this, I had a stat C-section, wasn't able to breastfeed, just don't feel connected. And so as I started seeing this, like, everywhere, and there's a saying that we learned in surgery at Emory, was the eyes don't see what the mind don't know. So once my mind knew it, I started seeing it everywhere. And I started digging into the research and finding, more of the science of it. And this really that our hormones are energetic molecules more so than chemical molecules. And so we give off this energy. When we have high oxytocin, good levels of serotonin, progesterone, we have this, higher energetic vibration versus when we're high cortisol, low oxytocin's like, stay away from me, right? So there's an energy to this. And so it started looking at the energetic medicine, quantum physics, and those components of how that also is related into our energy, our sense of get up and go, or enjoyment in life and joy. And so this whole process was really through my own struggles. And then when I realize when cortisol goes up and oxytocin goes down, we're in this acidic state in our body. And that's like a catabolic state, a breakdown state. And we feel it. Our hair gets weaker, our skin wrinkles. I mean, look at any president before and after term, they age rapidly. But we're in a high oxytocin state. Gosh, it looks like if you've had an orgasm overnight, great sex, for instance, you're like, oh, I feel so much better. This is, life is good. I have more joy, more connection, more vibrancy, all of those things. That's a high oxytocin state. It's a more alkaline state. It's a more anabolic state because in a hierarchy of hormones, oxytocin is that crowning hormone. It's the most powerful hormone in our body. It's rejuvenating and anti-aging, and it's alkalinizing, and it supports muscle cell regeneration, supports our immune system. I mean, there are so many benefits to oxytocin. So when we empower that, and again, we make it in our body naturally, sometimes I prescribe it, but when we can empower the practices that increase oxytocin, we're in a better place.
Yeah, and thank you for explaining all that. What are some of the tips? I read some in your book, but what are some of the tips that you can share with the listeners that would raise oxytocin?
Yeah, great. And so we know for example, with intimacy, with sexual touch, with play, with a hug and a kiss, we increase oxytocin. With laughter, we increase oxytocin. So sometimes I'll prescribe the movie, My Big Fat Greek Wedding. You you will make more oxytocin with that. You definitely will.
Yeah.
And things that make you laugh, people that you enjoy being with, having good community around you increases oxytocin. A practice of gratitude, meditation, and prayer decreases cortisol, increases oxytocin. Having a pet, I mean, gosh, when that pet greets you at the door and is like all full on love. I don't know, I'm not a cat person, but for dogs, for instance, they're like full on love. And you're like, okay, yeah, that's oxytocin. Those are some of the things that increase oxytocin. Of course, pregnancy and childbirth. I mean, many people don't realize as an obstetrician, I give Pitocin, that's oxytocin. Your body is producing oxytocin naturally to stimulate contractions of the uterus to help you deliver this child. And then you're imprinted to this child. You're bonded. You feel love that, as much as someone tries to explain it to you, never fully gets there because you feel this immense love for this child. And, that's part of a survival mechanism. Now I'm going to take care of this child at the sacrifice of myself, as a mother often does. And, but that's oxytocin, the power of oxytocin. While breastfeeding, we're producing oxytocin, further bonding, further imprinting. And the same thing with sex. We produce oxytocin, whether we orgasm or not, with intimacy and enjoyment. And that bonds us to our partner. Now, that's a double-edged sword if you don't want that. If you think I'm just going to play with this partner and not expect something long-term, then all of a sudden you're like, oh, maybe I can make this work. That may be oxytocin.
Yeah, I remember holding my daughter. I would have those like nightmares before you give birth. It's like, what if I don't like her? What if she's not what I thought, And then when you hold your child, no matter what they look like, you just think they're just amazing. And I just remember those first few moments with her in my arms. It was just so magical. And it's like the best day ever. So I totally felt the oxytocin flowing and coursing and still do when I look at her, which is amazing. Speaking of, let's dive into the topic of sex. I think, talking about what happens to our normal vaginal physiology is important for women to know, right? Just to know what goes on and what to look for. And when things do get dry down there, as you wrote so eloquently in your book, and you give so many strategies on how to help this. But let's just talk about, normally what happens to, we know the vaginal dryness, but more detail into that. And then we'll talk about strategies on how to protect the vaginal vault and that area so women could continue to enjoy intimacy, even if it doesn't look like traditional intercourse or orgasm. But like you said, just intimacy can have so many different ways that we could connect so we can get those advantages of oxytocin.
Yeah, no, this is one of my favorite topics because when I talk about what leads into lack of intimacy, the disconnect between partners. I always say it's three things, three Ds. It's issues of desire, disconnect, or discomfort. Those are the three Ds typically for the majority of clients when they, comes down to a lack of intimacy. What's keeping you from being intimate? Discomfort, desire, or disconnect. So those three areas. And just, aging is a natural part of life. And some, times we age more rapidly than others in our life. But just like all of us will experience laugh lines and smile lines, right, on our face, or we want, laugh lines and smile lines, not frown lines. I always teach my group to think of a word that brings a smile to their face because, we don't want those frown lines. And the changes that are happening here are happening down there, but they create consequences like incontinence, bladder leaking, right? That accidental leak of urine when we cough or sneeze, the decrease in orgasm sensation, less clitoral sensitivity, vaginal dryness, discomfort, odor after we have intercourse, discharge or discomfort afterwards, or frequent urinary tract infections. Those are all a consequence of the aging of the vulvovaginal area. So prevention of that is through healthy nutrition and lifestyle, healthy mitochondrial, good cellular function, healthy gut. An important part, I can't get someone's hormones balanced if I don't have a healthy gut to work with. So I got to get the gut healthy first and sometimes. But this is where topical hormones can really benefit us. So those natural changes between thinning of the vaginal walls, a loss of the elasticity, the normal flexibility. So we lose the rugation in the folds, and loss of the natural glandular secretions. And as we age, the pH of the vagina is designed to be acidic. So again, to fight off bacteria, to be a protected for protection, it becomes more alkaline. So that fishy odor, recurrent infections, etc., can become a consequence, completely preventable and reversible.
I think that's so important to know, completely preventable and reversible. And you give so many tips in the book on how to do that. And I think a lot of people just think lubrication, and I think lubrication is just one aspect. And I do want to call out the product that you've designed, Joel. I would love for you to give a shout out to this and talk about this product and how it can help women. And I'm holding it up again if you're watching the video version of this podcast. But what hormones are we talking about that would help rebuild and rejuvenate the vaginal vault, in addition to, this Julva product that you've eloquently made? And I've used it and it works wonders.
Great. Thank you. Thanks for that. And so typically when we think about vaginal dryness or, as we're aging, the focus has been on vaginal estrogen because we have prescription formulas that are, designed for just give us vaginal estrogen. And sadly, those prescriptions have a lot of hormone disruptors in them. And plus, if we're having sex with a male partner, then oftentimes we're getting transference of that estrogen to our male partner. And, guys, for the most part, I'll say for the most part, don't need more estrogen. Some may, but for the most part, they don't, right? And so you're transferring estrogen to them. And estrogen works on the first layer of the vaginal wall. That's the mucosa. So just like the inside of your mouth, the mucosa, the inside of the vagina is that moist, soft tissue. So estrogen does work for that. But again, it has the other consequences. And whereas DHEA and testosterone and even progesterone work on all three layers of the vaginal floor. So the subdermal layer to the muscularis layer. And that is really important because then all of a sudden you see those anti-aging effects, the increase of the natural folds of the vagina, the rugations, the glandular secretions, your vaginal pH becomes more acidic. And, and again, we have a lot of focus on the vagina, but you'll hear me say, clitoris to anus, the most important real estate of our bodies. When that area is not feeling good, nothing feels good. So from clitoral atrophy to urethral atrophy causing incontinence and urinary tract infections to perianal atrophy with fissures and hemorrhoids. It's not fun. And that creates susceptibility to yeast infections, bacterial infections. And, if anyone's had a yeast infection, that kind of ruins your day. So
And urinary
Or-
leakage, right? So this is
and
going to even help support the pelvic floor.
yes, DHEA and testosterone really do help with that. And so in Julva, I wanted something over the counter that patients could get economically without a prescription that worked. And so in my years of research and working with clients and formulating, compounded formulas, I created Julva, which has DHEA, which is a precursor and works at the intrinsic cellular level to make some testosterone and estrogen. It works on all three layers of the vaginal wall. And I combined it with plant stem cells from the alpine rose, which is a beautiful, it's in high-end cosmetics. It decreases fine lines and wrinkles that improves collagen production and rejuvenation. And, I have clients that have been using Julva since I first brought it to market in 2016. And I have one client who's 65 and she's like, Dr. Anna, I have the vagina of a 25-year-old. I love this stuff. And, and it looks that way. And again, I'm in clinical practice and I see the improvements that clients get as a result of that. I mean, you just can't compare with estrogen or lubrication only. I really need to add these proandrogens.
Yeah. Well, thank you for creating this product. And I think it's really important for women to know that their sex life is important, right? It just doesn't stop once we go through this change and have to suffer with these consequences of the loss of hormones and what it does and the downstream effects of them. So I really like that we talked about this. And so we educated, people to know that this is temporary and this is reversible.
Yes. And so many times I heard from my clients was that, I'm just powering through for the sake of my husband or partner. I'm just powering through sex, checking that to-do list off or whatever. But hold on a second. Sexual health is necessary for optimal health. We get, again, through our pharmacy, there's no other way we can make the amazing amount of chemicals that we do than in intimacy. But there's other ways too. Again, laughter, good life, giving, living, enjoying, contributing to society. There's certain ways. But with sexual health, it's for our pleasure. And, it is. So if you're not having pleasure, those mirror neurons that we have with our partners, they feel that too. So now we're creating a disconnect. And oftentimes women are going through vaginal dryness symptoms at the same time their partner, if it's male, will be having maybe erectile symptoms. And so now there's even, and again, reversible and treatable. And so, we work to address those issues. And all of a sudden the couple comes in and they tell me, Dr. Anna, we were like roommates before, now we're lovers and, again, and they're just so much healthier. And that's what we want. We want to support that type of connection. And again, there are many factors in relationship disconnect, but if dryness, discomfort, lack of enjoyment with sexual health and with intimacy, and it's something we used to enjoy, it's really important to get back there. And I have clients who will tell me that, they hadn't had orgasms in years and they are again. They're enjoying their sex life now more than they ever had. And, this is well post-menopause. So I love to hear that.
Yeah, beautiful. Because we've learned from maybe the generation before us that didn't talk about it, or we hear maybe in some friend groups that we just have to suffer through it. Like you said, I know I was talking with one of my friends and she says, oh, sex is starting to feel like razor blades cutting inside of me. And I said, oh, that is reversible. And when she found out and got, the proper help and put on the proper treatment, she's able to enjoy that connection, that intimacy, and it leads to, more emotional health, mental health, right? And then you have more enjoyment with your partner, your lifelong partner. And it just restores the relationship in a way that I want women to know that's available.
Mm-hmm. I love that.
Yeah. So you mentioned earlier in our conversation, looking at bioidentical hormones, but, correcting hormones doesn't necessarily fix the hormonal imbalance. What are some other tips that you use or can share with our audience? You mentioned the microbiome, but other things that they should be looking for or maybe doing so that they are, really setting up a great environment internally for their hormones to be able to function and work properly.
So one of the things is that, again, it takes more than hormones to fix our hormones. And when I realized that for my own health and journey, getting nutrition, lifestyle dialed in was really key for the hormonal transition and beyond. When our body's shifting in our production of neurotransmitters and hormones. So for me, I call it the keto green way or the keto green lifestyle. And it's nutrition support with, you know, periodically getting into ketosis. You don't have to be there all the time, but periodically getting into ketosis, the keto part of my keto green, that's getting into ketosis, not just high fat foods and all this, technical keto diet, butter and bacon. No, it's pushing our body into ketosis periodically because then we become more insulin sensitive. With more insulin sensitivity, less hot flashes, less, decline of our testosterone and progesterone, et cetera. So we start to see more of a balanced hormones, less inflammation in our body, less risk for all these other cardiovascular diseases. So first part, getting more insulin sensitive. The second part is that green part, which is the alkaline part, is what is making you acidic? Is it the food you're eating is very acidic, so which would affect the microbiome. If you're eating the same thing every day, you're going to decrease gut microbial diversity, and that affects so much. So the alkalinizing part for me is the greens, the alkalinizers, the fermented foods, the detoxifying foods especially for estrogen, like the cruciferous vegetables, broccoli sprout, one of my superfoods, and it supports healthy estrogen detoxification. So adding in those alkalinizers into your nutrition plan, bone broth, electrolytes, all those work at the cell membrane to support healthy transmission of energy across the cell membrane. So from there, we look at what else creates acidity. And this I learned from my own study and my own experience. In my programs, I tell my clients they have to check their urine pH and ketones and uric acid. So I have urine test strips I created with those 3 markers. But I want them to check their urine pH starting out with me every time they use the bathroom. Are you alkaline at certain times? What's that associated with? Are you more acidic at certain times? What's that associated with? And when I was doing that in my own journey, I realized that the mornings that I would gratitude journal or walk on the beach, I was more alkaline all day than the mornings I hit the ground running, and I was more acidic all day. And so that's when the study of cortisol, I dug more into cortisol, and cortisol actually increases hydrogen ion secretion across the renal tubules. In other words, it makes you pee acid. It makes you more acidic. So by recognizing that and regulating cortisol, so decreasing cortisol, increasing oxytocin, I was able to and the practice of gratitude and, being out in nature, doing things you enjoy with people you enjoy doing them with shifts your physiology. So that perspective came into that alkalinizing approach in managing insulin and cortisol and empowering oxytocin. All our reproductive hormones get better balanced as a result of that. So that piece of it was eye-opening for me. And what we know from studying urine pH, and there's many scientific articles on this, that the more acidic your urine pH, the more at risk you are for all inflammatory diseases of aging. The more alkaline your urine pH is, so 7 being neutral, so 7 or greater, 7.5, 8, on a regular basis, the less risk you are for all those inflammatory diseases of aging. So cardiovascular disease, cancer, osteoporosis, and in general, you feel better. So you're more empowering a optimum physiology that way. So that was so eye-opening for me at the time. Again, if I hadn't lived it, I wouldn't know it.
Yeah. And I like how you were talking about all these, it comes back to like lifestyle habits, right? Habits that you can stack on each other, the gratitude, the getting out in sunlight, the regulation of the sleep, you're diversifying your microbiome. All these habits that we can incorporate into our lifestyle that's going to keep our health functioning and lead us to have that longevity, regardless if you're on bioidentical hormones or not, right? These are practices we should be embodying because we know that they help so much of our body, right? From preventing disease to helping the vaginal area and maintaining that pH. I did want to talk about if people don't want to go on bioidentical hormones. You've created an awesome product called Mighty Maca, and I've been using it for a little bit now. And I've never liked maca in the past. It's always had this awful taste. Even when I put it in smoothies, it couldn't seem to cover it up. But I'd like you to talk about why you developed this and all the benefits that I was reading about in your book.
Yeah, thank you. So again, part of my personal journey, when I was 39, I was diagnosed with infertility, failed the highest doses of infertility treatment, 6 rounds of injectables, then diagnosed with early menopause, told I would never be able to have another child. And that was devastation on devastation for me and my family at the time. And I took a sabbatical from my medical practice and I literally traveled around the world. And I was part of my healing journey. And when I was in Peru, they would say, well, if you're infertile, drink maca. And if you're tired, drink maca. And then they would elbow my husband and say, it's the Peruvian Viagra. And you're like, okay, we're going to drink some maca, right? But I couldn't stand the taste of it. So I was like, if this is a superfood, this has potent ancestral origins. I mean, it's reported the ancient Incan warriors would drink maca before they went into battle to give them more stamina and drive and resilience, right? And so okay, well, what else is there? And I started adding different, superfoods as I learned and traveled and compiled all these and to make it taste good. Because I'm from a family of gourmands. I mean, it's got to taste good, right? And I feel very strongly too about that medicinally. Like if we have an aversion to something that's supposed to be good for us, is it really that good for us? So I wanted to enjoy it. And so that's where I started working on adding the different superfoods. So my Mighty Maca Plus formula has 30 superfoods combined. So with mangosteen, with acerola cherry, with cat's claw herb, which is a potent anti-inflammatory, with turmeric, quercetin, resveratrol, potent immune stimulants, and adaptogenics. And so I started adding all these great ingredients into it and to make it taste really good. I mean, my granddaughter's been drinking it since she's been just over a year old. And what we found is an improvement in DHEA levels, improvement in progesterone levels, improvement in blood sugar regulation, appetite control, craving reduction, all of those things that when I had formulated this and I wanted to keep using this for my patients, all these great other benefits came about. And part of my journey was that, it reversed the combination and grace of God, reversed my early menopause diagnosis, and that I naturally conceived my child I was told I would never be able to have, and at 41 years old. So it was really so powerful. And, it really made me open my eyes. My doctor's bag was pretty empty, when I finished residency, and I'm always learning, right? Like, what else can I do? What's natural? How is it supporting me? What's that mechanism of action? How do they work together versus the pharmaceutical approach, one drug, one action? And so, this is why I created Mighty Maca. And we've had, great benefits. So clients, for example, if they weren't candidates for hormone therapy and the history of breast cancer and hot flashes and vaginal dryness, can give them Mighty Maca and their hot flashes go away. They improve their energy. And again, it's a diverse ingredient, so it supports gut microbial diversity. And that's where we make serotonin and detoxify estrogen. So, very supportive in those ways.
Yeah, and you made it delicious. So thank you
it's
for
delicious.
that.
You're welcome. It's got to be. Yeah.
I will say when I put it in water at the first time, it's really a dark green color. And I'm like, oh, I'm not going to like this. But I was pleasantly surprised. And I do feel better when I drink it. So thank you for that. I'd love to ask a question. And I know it's kind of controversial. And if you don't feel comfortable talking about it, we can just say skip on this question. But I know some of my listeners have written into me and asked me, hey, I'm 10 years out post-menopause. And I think I missed the window for bioidenticals. And we talked about other ways that people can support their hormones when they feel out of the window. Would you like to comment on people who feel that they are beyond that window of 10 years out from menopause? And should they be looking at bioidentical hormones? Or do you want to comment to those individuals that may be listening?
Yes, absolutely. So again, it takes more than hormones to fix our hormones. And I'll also say I don't discriminate based on a patient's age. I want to optimize their health, create bodies, inhospitable to cancer, to create resilience and improve longevity. And so I want to optimize nutrition, lifestyle, movement, sleep, circadian rhythm, all of those mindset, like come to me with a positive mindset. And I know, you're going to do well, right? And so I want to optimize those things. And then I would use, and I do use transdermal bioidentical hormones or vaginal. I don't like to use oral estrogens post-menopause. Well, post-menopause, because of the risk of increasing inflammation and inflammatory markers, stroke, for instance. So, but transdermal, I can get great results with that and using a combination progesterone, testosterone, DHEA, estrogen. I like to use E2, E3 combinations. And so, and this is where, again, working with clients since 1999 with customizing bioidentical hormones, what makes you feel best? How is it working with your body? Let me support you have to support your detoxification pathways. And, if someone's coming in though, and they're driving through, fast food for all their meals and they're not a candidate at that point. I'm like, okay, there's a lot more we have to do here. I like to give the story, Sherry, about my father, who, when he was 79 years old, this is back in 2005. So when he was 79 years old, he came to visit. And this was many years after my mom had passed. And my dad was, born in 1926, World War II. He was in the U.S. Navy for 20 years and a naval attaché, basically meaning a spy. He could get anyone drunk and tell him anything, right? And so he had that personality. I never heard him say a negative word about anyone. And so at 79, he had come to visit from Philadelphia, flew in, had to be wheeled through the airport because he was having trouble walking. He was on over 7 medications at the time and 120 units of insulin. And he was just irritable and short-tempered and snapping. And I was like, Dad, what's going on? He goes, Anna, I just don't feel good. And I said, do you want me to call your doctor? And he said, please. And so I got on the phone with his cardiologist, who I'd known for many years. And I said, hey, Dr. B, Dad's having all these symptoms, blah, blah, blah. And he said, well, Anna, your dad's 79. He's lived a good life. And I waited for him to say something else, and he didn't. And I was like, oh. So in my mind, I could just see himself wiping his hands of my father, right? He's 79. Right. He's lived a good life. He's outlived most of, the rest of his cardiac patients, right? So I said, okay, well, do you mind if I intervene? There's some things I've been doing, studying, blah, blah, blah. And so he said, sure, just let me know what you do. And I go back to my dad, sitting on the couch still. And I say, Dad, are you done living? Because your cardiologist is done with you. He has written you off. And he laughed and he said, I'd like to see 80. And I was like, okay. He goes, Anna, I really, anything you say, I'll do it. So in 30 days, the 79-year-old man, written off by his cardiologist, said, lost 30 pounds, went from 120 units of insulin a day to 20 units of insulin a day at 79. And I was able to take him off 3 of his medications. I put him on some testosterone, some, supplements and nutrients. And by the end of those 30 days, he was out on the tennis court playing with the kids. Wow. And not only did my dad make his 80th birthday, but he made 91 good years. Wow. So it's such a good story. And I have clients in their 80s. I don't have anyone currently in their 90s or greater right now, but it's never too late. It's never too late to optimize your health and wellness. And so I say that story to really emphasize that point. Our body has this pharmacy within us, has this great rejuvenating, regenerating capacity. And when we get the right nutrients in the right amount, the right chemicals in the right amount with a good positive mindset, I see miracles. And so, yeah.
That's a beautiful story. And I love that story required almost no pharmaceutical agents, right? And actually, you took away pharmaceutical.
I took away 3. I added testosterone a little bit.
Yes. And you came down on the insulin. So, 3.5.
Yeah, huge, from 120 units to 20 in a 79-year-old. Who does that?
Right. It just shows you the power of these habits and keeping, our bodies well fueled through diet, exercise, sleep, all the mechanisms that you say that really support the body to go back to homeostasis, because that's where the body wants to be. It doesn't want to be ill. It doesn't want to be diseased. And so it will work hard if you support it, right? And detoxify it so that it can go back into that state of homeostasis. I love that story. And I love the age too, because I see so many women say, oh, I'm too old, or this is going to be too hard, or it's going to take too long. I mean, even in your story, you said 30 days. So
30
much
days.
transpired for your
Yep.
dad.
I'm going to say, give me 16 days and you're going to be feeling like a, much better version of yourself, healthier, happier. I mean, really, again, what the gut mucosal lining regenerates in 72 hours. I mean, our body is constantly regenerating. So when you now bathe it in positivity and alkalinity and, nourished and, you've got more oxytocin on board, when you're focusing on these things, I mean, it really is transformative.
Yeah. And, coffee, not that coffee's bad in itself, but coffee makes us more acidic. Alcohol makes us more acidic. I have to say that being on this podcast. And, a lot of ladies, think, oh, there's no harm to drinking a couple of glasses of wine, but that does make us acidic. And there is harm to the microbiome. Ultra processed foods, very, disruptive to the microbiome. And so clearing these things out of our diet. So, our bodies can be fueled and, our gardens grow inside of we can really support detoxification and serotonin to be produced. And that happens relatively quickly. Like you said, 72 hours, right? Just start seeing some of those beneficial effects. We don't have to wait as long as many people think we have to wait.
No, right. And on this alcohol subject, especially alcohol in perimenopause and menopause, I mean, it's an issue. It's an issue for a lot of women. And if you think about it, if our progesterone levels are declining, that's neuroprotective. Progesterone is neuroprotective. So now we really have less protection on the nervous system, and then we're drinking alcohol. And, for our momentary improvement, alcohol always disrupts our sleep. Less deep, according to all, sleep studies that I've reviewed, less deep sleep, less REM sleep, and more wakefulness, also getting up to use the bathroom at night. Alcohol disrupts our microbiome, like you mentioned, also increases uric acid. So it creates, a metabolic imbalance that leads to weight gain, brain fog, irritability, mood swings, less serotonin production. And so where this research came, I always like to think, again, I've traveled around the world. I love international medicine. I have family around the world. And I think, okay, well, like Sardinia, for instance, they drink wine every night into their hundreds, right? But are they drinking it alone? No, they're drinking it in community with friends and family and laughing and storytelling. Well, that's oxytocin, baby.
Yes, that's
You're
what the
making
alcohol.
more oxytocin. So you really have to look at the situation. And there was a time, and I'll share this with you, Sherry, and your audience, is that where I was drinking a lot of alcohol. I was drinking at least 1 or 2 glasses a night. And I was recognizing that it was not serving me. I was recognizing it was not serving me, but took a really long time to convince myself to do anything differently.
Yeah.
And as you improve your physiology, those cravings go away. Those cravings for sugar, cravings for alcohol, cravings for whatever, things that no longer serve us go away because we're radiating in a higher vibration. And we don't want anything to bring us down like that. And alcohol is a natural depressant. And so when we looked at those things, and as I work with clients in perimenopause and menopause, it's always a question, share with me, what is your alcohol consumption? How often? Are you alone or in company? And because it becomes this self-medicating in a way.
Yes.
And so you heal your physiology and
your cravings change. Yeah. And I know a lot of people are in disbelief, but when you live it and you experience it, you're just like, wow, it wasn't as hard when you go about doing it the right way of cutting back, that your body just feels better. And who doesn't want to operate in a body that feels better?
Right. Exactly.
Yeah. Thank you so much, Dr. Anna Cabeca, for coming on the podcast and sharing your wisdom with my audience. I really appreciate it. I just want to tell everyone I read your book twice because it's so good. Not that it's hard to understand, but it's so good. You give recipes, you give a 10-day plan in here to follow to alkalize your body, to get it healthy. So many great tips. So I recommend anybody who wants to really learn about changing their habits, changing their health is to pick up your book. But also, can you share with my audience where they can find you and learn more about you and your products?
Yes, thank you. So thank you so much for having me, Sherry. And you can find me at dranna.com. So DRANNA.com, dranna.com. And on social media at Dr. Anna Cabeca or at The Girlfriend Doctor.
Wonderful. And thank you so much for educating everybody and really turning the tide on hormone therapy and really being a champion for women's health. Appreciate that. Thanks, Dr. Anna.